A major update tonight in the investigation into the alleged abuse of vulnerable babies at Henrico Doctors Hospital.
As CBS 6 was first to report earlier today, the Virginia Department of Health has released the results of their probe, which found that the hospital failed to prevent child abuse.
Tonight, CBS 6 investigative reporter Melissa Hippolyte breaks down the key findings and talks exclusively to the father of a child who was treated by the nurse that has been criminally charged in this case.
Matthew Whitfield's wife nearly died when she unexpectedly gave birth 9 weeks early on October 29th of last year at Henrico Doctors Hospital.
There was a point in time where I thought I lost both her and my daughter.
At first, he had to split his time between his wife, who was recovering, and his daughter, who was in the NICU at the hospital. And he says he implicitly trusted the staff in the NICU.
We thought it was one of the best in the area, if not the state, and thought that there's no safer place for our baby and my wife.
But according to two scathing new reports from the state, the hospital failed to implement actions to prevent abuse or protect patients from abuse and neglect. The reports detail the results of an investigation that was launched after the Virginia Department of Health learned that multiple babies had suffered broken bones in the neonatal intensive care unit of Henrico Doctors Hospital late last year. The VDH Office of Licensure and Certification probe began this past December. The day after Christmas, CBS 6 was first to report that the hospital had posted an alert on its website saying that NICU admissions were being paused and that safety measures were being updated due to, quote, unexplainable fractures. Since that time, a nurse named Erin Strotman has been arrested and charged with multiple crimes against 5 premature babies, including abuse and malicious wounding. Whitfield says Strotman was the most consistent nurse tending to his baby within the first 2 weeks of her life.
We thought she was great. We never would have thought it was Erin.
The state investigation confirms previous CBS 6 reporting that Strotman, referred to in the report as EMP-11, was actually placed on administrative leave on September 10th of 2023 after 4 different babies that she had cared for suffered mysterious fractures. Those injuries were identified between August 5th and September 5th of that year, but were not reported to Child Protective Services until September 20th. According to the report, when the state investigator asked why CPS was not alerted within 24 hours about suspected abuse as required by law, another hospital employee, quote, indicated that the facility conducted their own initial investigation and then determined the facility would report the possibility of abuse. At that time, the hospital agreed to put certain safety measures in place to ensure more babies would not be injured. They installed security cameras in NICU rooms and implemented daily head-to-toe assessments of all patients to look for any suspected signs of abuse. But inspectors found the hospital did not review video from the cameras and discontinued the head-to-toe assessments in the summer of 2024 without approval from executive leadership.
Do you think that that should have been in place from the beginning, to have some sort of maybe random review of footage?
I think that would have been helpful. I think it would have been helpful for the hospital to have been reviewing the footage of at least Erin if they knew that she was potentially a suspect for what happened in 2023. I don't know why there wasn't more oversight of her work.
Strotman was allowed to return to the NICU a year later on September 17th of 2024 after the CPS investigation found that abuse had taken place, but they could not identify the abuser. The report states that upon returning to work, Strotman had to complete abuse and neglect training and work alongside a supervisor called a preceptor. During an interview, another hospital employee told the state investigator that after 3 days with the preceptor, the hospital had no concerns with Strotman's care.
Well, it is shocking to me that the hospital didn't do more, that they let her come back, that they let this happen again. I don't know how this happens twice.
Less than 2 months later, on November 10th, surveillance video showed Strotman holding one of the babies without supporting the head and neck, and also quickly twisting the infant's head with one hand while the infant was lying on their back. That same video showed Strotman, quote, forcefully pushing the infant's legs towards the abdomen with the feet almost touching the infant's face. 3 days later, according to the report, video captured Stroutman forcefully inserting a suction catheter into the baby's nostril and inserting it deeply. Another employee told the investigator it was the incorrect type of suction device for the nose. Ultimately, the state investigation found that the hospital failed to prevent child abuse for 7 NICU patients, though, as we said, Stroutman is currently only charged with crimes against 5 children. While there is no evidence to suggest Whitfield's baby was ever harmed, Whitfield says he is still haunted by what he says was a lack of communication from Henrico Doctors Hospital about what happened.
We were in the NICU. We had her as a nurse. At any time, they could have told us what was going on, and they never did.
Now, we should also note that the state was unable to interview any of the NICU doctors because an attorney representing them refused to permit an interview. VDH spokeswoman Maria Reppes says the agency will conduct a site revisit to determine if Henrico Doctors Hospital is continuing to comply with the plan of correction they submitted after the state inspection. Now, as for Henrico Doctors Hospital, Wes Hester, a spokesperson for HCA, said, "I want to clarify that our standard of care has always included a daily physical examination of our NICU babies by neonatologists." He also sent us this statement that reads in part, "The CMS report identified some areas that did not meet the standard of care that we expect and that our patients deserve. We worked diligently to address the findings, and CMS has accepted our action plan. We've been closely collaborating with regulators to further improve our NICU by increasing our training, implementing new security measures, and changing our reporting protocols." Find complete coverage of this investigation on WTVR.com. I'm Melissa Hippolyte for CBS 6.